the overall public health policy about the use of the drug by the general population, for us in public health, I think many people would argue for regulation instead of criminalisation. So that would enable people who think it's benefiting them with a health condition to be able to use it without fear of prosecution. But it also sets the market in a clear way, so that, you know, people aren't risking going to jail just for a recreational use. The question of the medicalisation, I think you do still have to have you know, properly conducted studies in order to determine whether it's really working or not, because, you know, there are very powerful placebo effects with any kind of medicine, and cannabis would be no different from that. I mean, it has direct effects on people's mental state, which may or may not influence the disease process, or may simply make people feel better. It doesn't mean it's not the right thing to do, but if you were then to argue a drug product with a license that maybe the taxpayer is going to fund, you would want to know that it was the drug that was making the difference and not a placebo effect. So I think they're two slightly different things. Obviously they overlap, but it's very important that there is a public health strategy, a policy framework that decriminalises the recreational use, but at the same time, if we are to advocate formal medical uses for the drug, then those have to comply with the same kinds of rigour that we use for other types of drug evaluation and licensing.